The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to another episode of Gate City Chronicles. I'm Kevin Avard, your host, and today we're going to be talking to somebody who's probably already familiar to you, Rafael Calderon.
You got it.
And welcome to the show. And we're going to be talking about Bell Tower,
Yes.
LLC.
That's right.
Now, when I first met you, Rafael, you were working for Lamprey Healthcare, and
Yes.
they're a great organization here in Nashville that helps people with healthcare. If you have very little bit of money, or if you no money, or a little bit of insurance, they're a place where you can go to get treated for all different types of things, which is a nicely held secret here in Nashville. It's a great organization. And now you're with Bell Tower.
Yes.
Are you the owner of Bell Tower? Did you start?
No. I'm an employee at Bell Tower,
Okay.
but I have a little more freedom
Mhm.
in conducting the CHW position. That CHW stands for Community Health Worker.
Okay.
And I want to say that I love Lamprey. I mean,
Yeah.
Lamprey Healthcare is one of the greatest secrets, like you said.
Yeah.
I spent about a year and a half trying to create awareness, bring the name out, make the name a household name.
They're on Prospect Street.
On 22 Prospect
Yeah.
Street. They do excellent service. They have excellent doctors, excellent nurses. I love Lamprey. I switched. I needed a change because I'm more of a community health worker is supposed to be a bridge between the community and the healthcare system. CHW is supposed to help people navigate through the system, be sort of like an advocate.
So if somebody's transitioning from wherever they come from, you help them, especially if they speak Spanish.
Yes.
You can help them navigate through the systems that are in place for them.
Yeah, I mean, you'd be surprised how many people don't know the options, the choices that they have when it comes to their healthcare.
Mhm.
There's a lot of people that don't go to a doctor per se because they think they're going to get a huge bill. In my culture, I mean, I work with everybody. My heart goes out to my Dominican Hispanic culture.
Are you from
Okay.
the Dominican?
Yes, I am.
Oh, where
See,
from?
I carry my flag with pride.
Nice. Now,
Okay.
whereabouts?
I'm from the capital, Santo Domingo, from a district called Villa Duarte.
Now, how close is that to Punta Cana?
I think it's about 3.5 hours.
Wow, that's a long ride.
And you know that I never heard about Punta Cana until I came to the U.S. And everybody's like, Punta Cana.
Oh, yeah.
I tell everybody, if you go home or if you go to my home or if you go back, go to Punta Cana. It's a great place. But also go to the interior of the country.
You know, I think that's something in the future I'd like to do. When we did leave the resort that when we went on vacation, we saw there's some serious poverty.
There is. I have
Some
to say.
serious poverty, and but we didn't get a chance to see much of the landscape. But when we went, we did a little snorkeling event, and
Nice.
way off in the distance you could see mountains.
Yes.
Very, very flat. You know, it was really different, but the people were very nice, very loving.
We Dominican people were awesome people. It's just like every country. We have good things and bad things. We do have some poverty, but we also have a lot of beauty.
Yeah.
And a lot of people that are proud of our heritage and do the best that we can to maintain our heritage. It's just like everything, like everywhere. You have a percentage of people that do well, and you go to those areas, and you'd be like, wow, this is a paradise. Then you have some poor areas, but if you go into the interior and you see the beauty, how people live, there's poverty, but there's happiness.
Yes.
You know what I mean? We enjoy life every day. It's a beautiful place. I mean, my parents brought us, me and my brother and sisters here, because they thought that we would have a better future here, better education. but the love for the country is always there.
Sure.
I love it here, but I still love it there.
So we went shopping,
Mhm.
and I like to sing, and I'm singing something like "One love, one heart, let's get together," and somebody said, "Hey, you white man, that's beautiful," and it was wonderful. It just made us all laugh, and it was fun to. They were very nice people, just
Thank you.
very wonderful and accommodating, beautiful people actually. We made some friends on
Thank you.
Facebook down there.
Nice.
So you're a go-between. You know, it's interesting, having gone to Punta Cana in the Dominican, you really rely on somebody to navigate for you.
True.
And when we were on the resort, there were some people that didn't understand English, but there was always that some person to bring you to somebody who knew how to navigate.
Right.
And that's kind of what you do in reverse here.
Yeah. Yeah.
So that's having been on the other side of that, saying, "Oh yeah, we need one of our group needed to go to the doctors." So we had to go to the doctor's office, and she spoke broken English, and she sent my brother-in-law to the hospital, arranged it all, because he had an ear infection.
Uh-huh.
This is the truth, you know. And it's interesting how that, wow, it's just a simple ear infection. Yeah, well, you needed to go to the doctors because you're going to get on a plane, and that could get infected. So I experienced it in your country, and somebody was able to help us. Now, here, you help people in the community that speak broken English,
Right.
if any at all, and let them know not to be afraid. There's help for you.
Right. No, and I do work with everybody, not just the people with the broken English and not just the Hispanics, because the reality is that for some reason there's a lot of I would say lack of information or lack of knowledge in the community, and you have a lot of people from all walks of life and all cultures and ethnicities that for some reason don't go to a doctor unless they have an acute problem.
Mm-hmm.
Then when they have an acute problem and they go to a hospital or a clinic, if they go to a clinic, then they have to go through an intake process, which is the way it works. If they go to a hospital, if they go to the ER, they have to go through a process and wait, and so on and so forth. People seem to or tend to avoid that, and they live with the pain, the issue, until it becomes unbearable, and then they go. So part of what I do, more than as part of being a navigator per se, or a bridge, I like to call myself a bridge. I educate people. I hold workshops, healthy heart workshops, Better Choices, Better Health workshops. Now I'm working on a Spanish version of Better Choices, Better Health, which is called Tomando Control de su Salud, which is basically how to manage a chronic disease and also how to live a healthy lifestyle so you don't end up having one.
Mm-hmm.
So I mean, to me, it's a pleasure to be able to be useful to people because it's just like your friend in the DR. An ear infection is not a big, well, it's bad, but it's not the end of the world if you can just go to a doctor, right? A hospital. What if you don't know how to go to the hospital? What if you don't know what it is? What if you don't have somebody that can take you there? That problem of this size can become this size, and then you have consequences.
Mm-hmm.
So that's the importance of a community health worker. And that's I'm now with Bell Tower Home Health Care because I feel I can do so much more. And again, I like to point out I love Lamprey. I mean, if things are different,
Lamprey Healthcare.
Lamprey Healthcare, yeah.
Mhm.
I mean, I love the place, and we at Lamprey they see more than just low-income people per se. They see anybody and everybody. It's just that because they see mostly low-income people per se, then you have that.
And it is a beautiful facility. It's nice
Mhm.
and clean. It's practically brand new. It's basically on the corner of Prospect and Harbor. Now, does Bell Tower have a clinic itself?
Not a clinic itself, it has a location. See, Bell Tower Home Healthcare is about providing clinical home health care. So when someone is homebound
Mm-hmm.
and they need a nurse to go to their homes, then we provide that nurse.
I recently did a ride along with um, Meals on Wheels,
Mhm.
and we saw a lot of people that were shut-ins, and all around Nashua, and we brought them their meals, and some people couldn't come to the doors, so you would probably go to places like that.
Yes, see, thank you for doing that, by the way. I appreciate that. We need more of that.
Oh.
Just yesterday, I went to 56 Tyler Street. It's a senior housing community.
Yeah, it's right parallel with Prospect Street.
Exactly. And I went with a friend of mine. She's very shy, so I can't say her name without her permission. But she does a lot of community work. And I went in and I saw these nice people, senior people. Some of them had some physical situations, and they found it very difficult, if not impossible, to go from 56 Tyler Street to the Salvation Army to pick up this food. And the Salvation Army is like at the end of Main Street.
Yeah, it's a few
Right.
blocks away. Yeah.
For you and I that can walk per se, then it's no biggie. But for those people that could not do it, to have my friend and myself deliver this food to them, it just made their day. See, there's a lot of people in Nashville that are homebound that it's not so simple to them to take a 10-minute walk.
Right.
And they need someone to be able to reach out to them. And now I'm in a position where I can do that. You see, in the past, I could be whatever someone needed me to be as a community health worker, but within a certain perimeter. Now I can do home visits. Now I can go to people's hospitals. Yesterday, I went to see a patient. She was staying at the one I was telling you before the show came on. She was actually in the hospital. So I took the chance as a community health worker. I could go in, talk to her daughter, counsel the family, be a motivational interviewing, provide social services, and this is all part of Bell Tower's services. Is we take care of people at their homes, but if they end up at the hospital and they need something else, then we still want to be there for that patient.
So how is Bell Tower funded? Is it a private organization?
Yeah, it is a private organization.
Okay.
It's a new one too. It's been around for about a year.
Okay.
And we're in the process of becoming certified by Medicaid, so we are pursuing patients. So if you know any patients that are homebound, because the idea is that we want to start this organization not just so that we can get a whole bunch of patients and become huge. What we want to do is educate people, people especially that are working in, let's say, fast food jobs or retail jobs. If they don't like it, I mean, if they like those jobs, then that's awesome. But if they want something better, then we want to train them to become a personal care assistant, then an LNA if they want to, then eventually show them the path to become an RN or an LPN or stuff
Now,
like that.
do you work at all with the Adult Learning Center in Nashua?
We are in the process of working with them. I'm actually right now taking a hospice training so I can learn how to help people who are in a hospice situation. And I'm doing it through Bell Tower. I'll be conducting a healthy heart workshop with them soon. And the Adult Learning Center is so helpful. It does so much for the community. So for me, it's a privilege that they're letting us in to work with their students.
Now, does Bell Tower train people, or do they? How are they facilitating with people? So, if somebody has a need, do they call Bell Tower? Do they call you? How does this work?
They call Bell Tower,
Okay.
and then they are transferred to me because as a community health worker, I can help them with anything that we need to keep them healthy, anything that is non-clinical.
Okay.
But clinical staff, we have an excellent nurse, and she goes out to their homes.
What is your background? What type of background do you have?
Oof, I have a long one. I mean, but as far as healthcare-wise, is I started back in 2004. I became a certified Spanish medical interpreter.
Okay.
And I did that on and off. My real background is in employment services. I love helping people find jobs. And when I got into Spanish medical interpreting, I found that people couldn't live a healthy lifestyle because in being an interpreter, then people tell you things because they had to work so hard, sometimes 2 to 3 jobs. A lot of times because there was a language issue, they didn't speak English fluently, so they couldn't get educated properly. So these people would tell me, I need a better job. So it was a pleasure for me to work during the day as an employment services, as a recruiter, and then on the side, or whenever I could, I would be a Spanish medical interpreter. I did that for about 10 years on and off. Then it was 2 years ago that a friend of mine told me about becoming a marketplace assistant, helping people get health insurance through the Affordable Care Act. But those jobs are temporary, so you do it for a season during enrollment period, and then you have to look for something else. So I was basically going from that to Spanish medical interpreting until a friend told me you should go for the community health worker training because you do so much for the community. It's like you've been doing that job informally. So I went to that training, and about a week before that training, I finished that training. That was back in November of 2014. Someone told me that Lamprey Healthcare was looking for a community health worker, and thank God I ended up working there.
Interesting.
Yeah.
So you've been doing this for a while, and it's your passion.
It's my passion.
You're a man of faith.
Yes, I am.
And that's part of the faith is service.
Yes. Yes,
Is
service
service.
to others.
Yeah, I think Jesus said something to the effect, if you're going to be the greatest in the kingdom of God, be the servant of all.
Yeah, learn how to service the many.
Yeah,
You want to
service,
be great? Learn how to service the many.
service many. And he led the example by washing the feet
Yes.
to his. So anyway, that's always the best example. Humble yourself and help others. So a little bit more about Bell Tower. How did they get started? What's their genesis?
Interestingly enough, it is a company owned by let's say, two cousins. Well, it's a whole family, but I know two cousins. And I'm afraid to use names because of HIPAA laws and
Sure,
stuff.
that's fine. You don't
But
have to.
they actually started the company because their father became ill. The guy's father became ill, and he went to the hospital, and a local hospital, and they felt that the interpreting services in which the hospital would have different interpreters come in, and it's nothing that the hospital can do about that, because you can't have the same interpreter coming in to a one person, assigned to one person, because it's a per diem position. But the thing is that every time an interpreter came in, the family felt that they were a bit disconnected from the service, and they felt that the father couldn't communicate directly with the doctor
Mm-hmm.
or the nurse that went to see them. So they just said we should, we could do something better, because we both have our jobs, but we could put them our careers. I'm sorry, we could put our careers on hold and dedicate ourselves to bring this service that is very needed to the Hispanic community. But then, as they started doing research, the cousin, a guy, and a girl, they came to find out that there's a huge need for these services in the Hispanic community and the community in Nashua as a whole. So they decided to start Bell Tower, and it started out of 5 Pine Street, and it's been growing ever since. And I actually met him when I was doing a Dominican Independence celebration, since you've been to the country.
Mm-hmm.
And they said, we're looking for someone that can help us grow. And I said, well, I'm looking for a place where I can use all my community health worker skills, so maybe we should talk. And after a little while, then it turned out that we wanted to come together. So now we have a registered nurse who's been a registered nurse for 10 years. That's the lady, the cousin. And then the guy who worked for, like, I don't know how many years at Fidelity, so the guy's very smart. So they put together this program, turned it into a business. Now they brought me in alone, and we've had some successes already. We're already helping some people.
Now, when you're helping some people, there's some people that they don't have any money. How do they pay a fee to Bell Service, or is there a fee of some sort for the services that you provide?
That's a very good question. The goal is that people have Medicaid or Medicare,
Mhm.
and then those services would take care of it.
Okay.
But the beautiful thing is that we're in the beginning stages. So right now, even if a person doesn't have any of those, we'll still work with them, because technically we have to prove to society that we are useful,
Right.
and that we can help, and that we're professional and prepared. So right now we are taking in patients, and there's no cost to the patient at all.
Rafael, are you running into any of the problems with that? And we have a problem with opioids in the state, and there's some serious problems. Are you running into that when you're out in the field?
Of course.
Yeah.
Of course, it's a very sad situation. I come upon it all the time, and I talk to people, and I ask them, what's the reason why you're in this situation? And when you read the news or hear the news, and a lot talked about people who are for pain, because they feel some pain and they have to replace the medication that they can no longer afford or something like that. But for me, most people tell me that they feel lonely, they feel depressed. Of course, some are pain related, but something happened in their life. They had an event and they couldn't overcome it. So they felt numb inside, and they took the pain away. So they would take this thing knowing that it would affect it negatively, but at least they didn't feel the pain. And then it came to a point where they couldn't do anything about it. You see, and that's one of the other reasons why I like being freer as a community health worker, because now I can use motivational interviewing to help that person. Because in reality, what we do at Bell Tower is we work with the patient's doctor. So a person doesn't have to leave their PCP, their doctors, to come with us. We can just work with them. And I actually have spoken with 2 people that we are in the process of them working with us, precisely because we can communicate. See, I've been talking to people, and 4 people for what? More than 10 years. So it's easy for me to make a connection. And I sincerely care, because I do want to follow Jesus Christ's example. I'm not religious, but I'm very spiritual. So for me to be able to listen to someone, make them feel that they've been listened to,
Mm.
it's huge for people. And then you use motivational interviewing and you get them talking about the changes that they need to make.
Right.
Because that's one thing that you see a lot in the medical field is you see some doctors, because most are now changing to preventive and stuff. They will tell a patient, this is good for you, it's important that you do this, this, and that. All the while, the patient is thinking in on the back of their heads, I'm broke, I have no job, how am I going to pay this bill? I have some personal issues, I don't know what to do, and this doctor is telling me to give up the only thing that takes away the pain every now and then. And that's why you have so many people that seem to be in a cycle of going back to ER. Well, the idea of motivational interviewing is that you get a patient talking about how they can get better, how life would be better for them if they were able to overcome this or that problem.
Right.
And of course, you need to work with a primary care provider because I can't do anything clinical. That's why we have a registered nurse.
So we want to help people become productive, to help them overcome the cycle that they get trapped in, and get them assimilated into the community so that it helps everybody.
Exactly, because think about it. When somebody starts using this, I'm not going to use that word. It's not a good word, but start using, let's say, opioids or drugs, or I'm using opiates or whatever. You have 3 stages. People use, abuse, become addicted. So when people use, instead of trying to find a clinical solution to that, I would talk to the person and say, well, what brought you here? What happened? How did you forget that you were part of a divine creation,
Right.
where you can create any life that you want for yourself? Tell me what happened so I can try to help you find a solution to that problem. And maybe you won't need me to tell you to stop doing it. Maybe you'll want to stop doing it yourself. And if you watch a lot of testimonies from people that have become better, that are in recovery, they all tell you that they themselves came to a point when they just didn't want to do it anymore. They valued themselves a little bit more and they wanted to stop for themselves or a loved one or whatever. So I think that what I do as a community health worker, what I'm trying to bring into Bell Tower, is that you connect with the person, you find out what the problem is, then you use motivational interviewing and working with their primary care provider, and then you put those 2 together, and you can get the person to go back to who they were when they were happier. Now you have a healthy person, you have a more productive member of the community, and that person can now be an example to other people.
Now, having interviewed a number of people in Nashua, there are all kinds of resources around here to help people.
Yes.
Every block, it seems, there's an organization ready to help, extending a hand. But if somebody doesn't know how to communicate, you can bring them together.
That's the idea.
Yeah.
And I don't bring them just to, before I wouldn't just bring them to just Lamprey Healthcare. Now, not just to Bell Tower. I bring them to wherever they can get the help. Because the idea is to be useful.
Right.
If I'm useful enough, eventually my job will take care of itself.
One of the things that we see a lot of hurting people, and Tracy and I, my wife, we like to watch the series called Intervention. And you were talking about something tragic happens in somebody's life, and sometimes that numbing thing helps them through this whole process, and then it just escalates into something that is a road to destruction.
Yes.
And they want to destroy themselves. One of my concerns lately is it used to be that people would go to the church, and it seems as though people have forgotten about the church and or the synagogues or the places of faith. Those are excellent resources as well.
I agree.
And they need to be part of the solution, I think. A lot of people are saying, the government needs another program or this program or that program. But there's something inside that's making this pain with people. And I would like to see more involvement of all the churches, of all the denominations getting together and helping be part of the solution. They really, there's an opportunity here to serve, and I appreciate everything that you're doing here.
My pleasure.
What are the first things that you encounter when you meet somebody? Is there a trust level? Is there an area that you have to build a trust relationship with some of your clients?
Always. Because whenever you approach someone that doesn't know you, and you say, I have something that can help you, they automatically see a salesman sign on your forehead. automatically.
Yeah, yeah.
It's just the way it is.
Yeah.
So what I do is I try to make myself visible so that when people see me, they see me being useful, being helpful, and then they know I'm not trying to sell something.
Yeah.
So the trust level, yes, people will look at you in 15 seconds and make a decision if you are a salesman or not, and that will decide if they open up their arms and say, "Come help me," or if they say, "Stay away from me," and they put up that protective wall.
Mhm.
So I try to gain trust by just being myself and just being useful, just saying I'm here to help. I don't know what your situation is. I just know that I want to help you. I help other people, and whenever you're ready, then you let me know, and I'll be happy to help you. I read one day, I think it was in A Course of Miracles, something about Jesus, that he said to someone, I don't know who it was. He said, "If you know that you like me, I will help you." No, he says, "If you know that you're alike, then I'll help you. If you think that we're different, then I'll wait for you, because you know what? At the end, I know you'll change your mind." So it's when I tell people, I'm just like you.
When I'm sure there's some young mothers that need help. There's got to be a serious trust level there as well. There's a number of young ladies that need help. There's organizations. Do you find that that there's a large population of people, in youth, young ladies that are really struggling
Definitely.
in the community in Nashua itself?
Yes, and I can tell you, I've again, due to HIPAA laws, I can't tell you details, but
Yeah, I don't know.
I've spoken with a lot of young ladies, single mothers, and from all walks of life, and they all need help. And in the past, I could only tell them, go to this place, go to this place. I mean, I referred a number of people to Bridges, to the Bridges program.
Right.
Now I'm intend to do more with them. And I have this belief that when you walk in the side, and I don't want to sound religious, but on the side of, let's
It's
say,
okay to sound religious once in a while.
oh, okay, okay.
Yeah, yeah.
When you walk on the path of God, and you sincerely mean to help others,
Mhm.
then people can read that. People can see that. You know that recently I started spending time at the Boys and Girls Club, because I'll be starting a summer program there, teaching kids job readiness, life skills.
Yep.
Preparing them to have a better future, and to give them an option so they don't fall into this, abusing alcohol or drugs or what have you. And people would tell me, "Well, how are you going to get those kids to trust you? They don't know you." And I go in and I just smile, say hi to everybody, start playing pool, start playing ping pong. Automatically, Kevin, they come to me
Mhm.
and they say, "Hi, can I play with you?
Yeah.
How are you?" See, kids are they're generally good.
Do you
Okay.
teach Spanish?
I used to.
That would be a wonderful bridge right there, because that's
Okay.
just on a very elemental level. That opens doors. That and music.
Mhm.
Listen, I got to cut you short because we're running out of time.
Mhm.
How do people contact you?
People can call me at 603-892-1980, 603-892-1980, or they can email me, and I use my personal email because I can get it through my phone. It's Q as in quantum, S as in Sam, Q as in quantum, U as in under, E as in Edward, Y as in yes, A as in Apple, @gmail.com.
Wonderful. Appreciate you coming
Hey,
on the show. I've been
thank
asking
you.
you for a while now, so I'm glad you made it.
I'm finally here. I wanted to be here.
All right. Well, thank you. Thank you for watching Gate City Chronicles. If you know somebody that needs some help and maybe needs an interpreter or somebody to bring them along that can come alongside, contact Rafael. This is a wonderful opportunity for them. And if you have a story and you want to come on the show and talk about your event or your nonprofit or how you can contribute to the community, we'd love to have you on the show. Again, thanks for watching Gate City Chronicles. See you next week. Thank you for watching Gate City Chronicles, and we want to thank our sponsor, Aardvark Cleaning. They've been a sponsor for quite a few years now, and we appreciate them being a sponsor. And if you want to be a guest on our show, contact accessnashua@gmail.com. We'd love to hear your story. Until next week, thanks for watching.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.